PCR. I mean, I go to scientific conferences everywhere, and it's a total different. At our obesity week this year, there was in our little packet, a little thank you to Coca-Cola for sponsoring. The food was horrible, and in 1 week of discussing bariatrics and obesity, there wasn't a single lecture on what these patients are eating. Can you believe that? 1 week of obesity conference, not a single lecture. My name is Garth Davis. I am a weight loss surgeon, but I also do medical weight loss. I guess, Joel, if you're the badass of vegan of Detroit, I'm the badass vegan of Houston. Yeah, they've gotten to know me there. I'm more of the angry vegan, though, because, and I sense it in Dr. McDougall when I hear him. I'm just getting pissed off. I can't stand it anymore. It just seems so obvious now. Everybody's looking at social media and what people are saying there. I wish people could come with me to my clinic because it all becomes crystal clear. I wish all of you could come to my clinic because you all have tough patients, you got diabetics, but you got to see my clinic. If there's a patient with extremely bad heart disease, they're in my clinic. If they got bad diabetes, I have extra wide doors, extra huge toilets. I see the sickest of the sick and the worst of the worst, and I will tell you a few things about these patients. They're not stupid. They don't want to be fat. They're not lazy either. I mean, it's hard to move when you're 500 pounds, but they've tried everything. It's not like they've never dieted before. They've tried dieting. I'll tell you the central problem is they're confused. They don't know how to eat right. Because we might think that the Time magazine cover is absolutely ridiculous, but to them, that's what they know is fat. And you know who else is confused? Is their doctors. Their doctors are confused because when I went to medical school, I had exactly 10 minutes of nutrition training. I'm literally 10 minutes of discussing food and macronutrients. We never, as doctors, and it's not a conspiracy, doctors aren't trying to keep people sick so they can get rich. That's just not true. They do what they've always been taught to do, which is to treat a patient. We're never taught to prevent disease. We're taught to treat the problem that comes to us. So they don't know how to treat the patient. They don't know anything about this food stuff. And that's why they send them to me, because they just don't know. And after a while, they feel helpless. And what has happened is both the patient and the physician have forgotten the first physician's famous words, which is, let food be thy medicine and medicine be thy food. Medicine has become simply this, not preventing, but doing this. Or in my case, actually cutting people open and doing surgery. So I'll cut their stomach and I'll divide their intestine. It's a dangerous surgery. Unfortunately, like Dr. McDougall says, it works. It works too damn well. One of our earlier speakers came up to me all excited to tell me that at their national meeting they decided in the endocrine society that they're going to refer people for gastric bypass surgery even when they're not obese, which I guess would be great for a surgeon. I think it's depressing. We're going to start operating. This is going to be our primary treatment for people that are diabetic. Yes, it works. It works damn well. And it works because people can't eat as much, they can't eat fatty foods. We change some hormones in their body, GLP-1, GIP, these different things. And yes, it's more than just not eating. We do hormonal changes, which is why you see different surgeries work, like this surgery, which is the duodenal switch, which absolutely cures obesity. Now, interestingly, this is a malabsorption procedure. So if you eat fat, you don't absorb it. If you don't absorb it, you don't get intracellular fat. You don't get intracellular fat, you don't get diabetes. But you also have to get rid of the fat, so you have diarrhea. Like Dr. McDougall said, there's many ways to make people lose weight. It's effective. But here's the thing. I started, and I'm embarrassed because don't look up books written by me, because there was a book written that was actually very popular amongst weight loss patients where I said eat a very high protein diet, because that's what they tell you to do. They tell you to eat a very high protein diet. And when I started doing bariatrics, I was told to tell people to eat a very high protein diet. And so that's what we told people. But I started seeing something. I started seeing a few things. People were coming back with diabetes. They got better and then they got back. Let me tell you, that's depressing. Seeing the light and then getting sick again. Or they were coming back to me, and maybe you guys have seen some bariatric patients, they just look sickly, almost gray. And I myself was getting an expanding belly at the time and a high cholesterol, and I said, this just can't be the natural order of things. And so I started doing, like we talked about here, self-educating. And really took doing my own research to find out I was doing it all wrong. And what I found is that because I didn't know and other doctors didn't know, we couldn't help the patient, and the patient's completely confused. So let's get to the basics. What do I do with patients to educate them about food? Well, the first thing I do is quiz them. I like to use Socratic method because I want to bring out to them how much they don't understand about nutrition. For instance, I hate macronutrients. I mean, I absolutely hate it. I always tell my patients, don't come in and tell me how much protein. I don't want to hear it. Because food is not protein. Food is not fat. All right? Food's an avocado. What's an avocado? Is it protein, fat, is it carbohydrate? So, but I will ask them in the beginning, what macronutrient causes diabetes? And of course, what do you think they say? Oh, it's carbs. I mean, look, patients, I take food logs. I've got millions of food logs. And when you look at these food logs, it's pretty clear what's making people sick, okay? When they're eating eggs and bacon for breakfast, Subway sandwich with the meat for lunch, and dinner's a steak, or if they're trying to be healthy, chicken, and then I say, well, why are you becoming overweight? And they say, well, it's carbs. And I'm saying, okay, where are your carbs? Well, I didn't tell you, but I did have a bag of chips yesterday. Well, that bag of chips didn't make you overweight. Well, look at the calorie differences. So they definitely think carbs are bad, and especially my diabetics. Was a potato good or bad? What do you think the universal answer is to that? Their doctor told them not to eat potatoes and not to eat rice. And so I say, oh yeah, rice is bad, right? Well, explain to me how this guy's been eating rice all his life. And I use pictures because pictures tell 1,000 words. And it kind of gets them hesitating when I start to talk to them about the Okinawans and what their food pyramid looks like and how many yams that they eat and how their weight goes down eating rice and potatoes while ours goes up. And then they start to think about it. And I show them how if you change their diet by bringing our diet to them, then they start getting sick. I love to bring up Dr. Barnard's work. And I love it because I teach these, and we'll get to that, I teach these diets, but I talk to them what a typical day diet ought to look like, because they don't have a concept of what a typical day diet should look like. And I have on here, as you can see, the things that were in this Dr. Barnard study where they fed people, and there's bananas and cantaloupe, and they're like, bananas and cantaloupe? I can eat bananas and cantaloupe? That can't possibly be true. But I show them that, in fact, it is true. I talk to them about grains, which are universally bad. If they tell me they have gluten sensitivity, I tell them that's absolute nonsense. And I show them the studies about why that's nonsense, and it is. There's a recent study about the placebo effect of this concept. But I show them the Cochrane group, which is real science. And I share the science with them. They're not stupid. They can understand science. We definitely delve into fat, and I get them understanding what we've already talked about, that meat is related to diabetes. And this is new to them. I'll say to them, what do you think is most related to diabetes? And they'll say sugar consumption. And I'll pull out the EPIC study and hand it to them that says sugar was not related with diabetes, but meat definitely was. I talk about calorie density, but you can't show it like this. But if you show it in diagrams, I use a lot of diagrams with my patients. This they can understand. Eat a tiny bit of oil, 400 calories, that's what your stomach looks like. Fill up your stomach with fruits and vegetables and starches, and that's what you get. I will tell you that I think the worst recommendation a doctor or a nutritionist could possibly tell their patient is to eat more protein. I think protein is what is killing us. Okay? And I'm writing a big book about that right now. And it's not necessarily that protein itself, although in excess it does, but it's that when you tell someone that they need to eat protein, they think protein, they need to eat more protein. There's protein everywhere. There's vodka with protein in it now. And it's absolutely ridiculous. Products everywhere are selling protein as a protein. And we're so busy in the scientific community arguing saturated fat versus carbohydrate. Protein has escaped the equation. And now everybody's telling everybody to eat protein. It's what's for dinner. And let me tell you, when a patient hears protein, all they think is beef, okay? Protein and beef are synonymous. So I say to them, okay, if you think you can, and there was a study that was done on this that 75% of people think they need to eat more protein. And so I showed them this graph. I'm like, we eat more protein than any other country in the world. I mean, we're eating 80 to 100 grams of protein, sometimes more. My patients are told to eat 120 grams of protein a day. And they're only supposed to be eating 52, 46, depending, grams of protein a day. We're doubling what the RDA is. And how's it doing for us? Well, we spend more on healthcare than any other country. We've got the least longevity. We live the least. We eat the most protein, we eat the least, we live the least. We're getting fatter every year. We're getting more diabetes. They tell me, well, what about the insulin? I said, you think carbohydrates are the only thing that causes insulin? You get as much insulin from eating a salmon or you eat a piece of meat. And I showed you visuals. You know, I want a visual picture in their mind of where their meat comes from. I want them to know what the chicken used to look like and what it looks like now before it goes to slaughter. And I go over the studies, like the EPIC study that looked at 500,000 people over 10 years, and I asked them, what was the #1 food that caused weight gain? They say bread, and I showed them the paper. You know what it was, right? Chicken. Chicken was the #1. That chicken is my patient's health food. They think chicken is healthy when they eat it. So this kind of confrontation with what they know. I like to tell them stories. I tell them the stories of the Pima Indians you guys have heard. I talk to them about the Seventh-day Adventists, and I show them these pictures, and I show them these graphs. And I think a kernel or a seed of thought starts to get in. I show them lots of pictures. I want them, I actually have my patients do collages. I want them to take a picture of what their goal is, a person crossing a finish line or something like that. And then I want them to take pictures like this and put it next to that and put it up. So when they see this picture of these beautiful fruits and vegetables, they also see a picture of their goal, and their taste will start to change. I want my patients to think before they eat, and we talk about this a lot. About thinking before you eat. Where does your food come from? I want them to know where their food came from. I want them to think about that. I have them journal. I think journaling is hugely important, and it gets this conscious knowledge where we are very unconscious eaters. And I want to show them, because I used to love double cheeseburgers. Now I look at this and I want to vomit. And it's not that I don't eat a double cheeseburger because I want to eat healthy. I don't eat a double cheeseburger because this is disgusting. And that's the change that I got to see in my patient. And I always tell them the story. I went on my first vegetarian retreat where I'd never really been vegetarian before, and it was a meditation retreat, and I was supposed to be learning to meditate, but I was eating this food and it was so good. I never tasted food. I felt so good. It was ruining my meditation because I was meditating thinking, what's for lunch? And so I go back to the guy, and this is the guy this is what the chefs look like, and I went in there. It was like a classic out of a movie. He's chopping his French, and I'm like, what is it about this food that makes me feel so good? And the guy's like, oh, it's because I make it with love. And so I tell my patients, I get this visual in their mind, eat food that's going to make you feel like it's come from love. You are what you eat, so, be this guy. I show them pictures like this. Choose food that's full of life. We have a lot of support groups, but I realized, as was mentioned earlier, the patients need to learn how to cook. So I took the Food for Life class, and I teach them how to cook. And believe me, I don't know how to cook. So if I could teach them how to cook, anybody can teach them how to cook. And my classes are sold out, right from the get-go. I show them what I eat. So on social media, I'm pretty big about showing what I eat, because patients have no concept of this food. I show them my breakfast. I show them my lunches. I show them my dinners, and I show them how I eat them in 5 minutes because they're so good. I have them eat food they would never consider eating before. I show them this in my support groups. I try to show them that you can change your mind, because if you do what you've always done, you're going to get what you always got. I try to teach them by example, too. Don't be a hypocritical doctor. I practice what I preach, and I think by showing them that, it's just like showing your kids that. They will learn it, and they will understand that this diagram, that should you work out today? Yes. Go work out? No. Yes, you should. I go over this Panacea study that showed just doing these simple things will increase your life expectancy, and I let them know that yes, you can do it. My newest project, and this is the last thing I'll talk about, is a thing called pharmacy, F-A-R-M-A-C-Y. I've got my hospital into this. We've printed up prescriptions because we talked about how powerful a prescription is. We got money from the hospital to buy organic produce, and now I'm having doctors in my hospital, and the doctors know me. Every time I go into that doctor's lounge, they're scared of me and hiding their food. And I've actually scared them into actually writing prescriptions. So they see a patient, and I don't want it to just be me doing this. I want all of my doctors doing this. If they see a patient, they're a cardiologist, guy's got high cholesterol, they write a prescription for fruits and vegetables. And they're going to take that to our lobby of our hospital where we've set up a pharmacy, F-A-R-M-A-C-Y stand, and they will get a box of produce with our pharmacist, F-A-R-M-A-C-I-S-T, who's going to give them recipes. My goal with this is not just to show the patients that food is medicine, but to also remind the doctor that food is medicine. And that's what I think we need to be doing. So I thank you all, and welcome any questions later.